Hello there, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Monday Facebook Live update. Let's see, today is Monday, May 24th. So we all survived a beautiful, beautiful weekend. Lots of things going on around town, which we'll talk about in a second. So just to put us into perspective, in Alabama, we have over 540,000 cases of COVID-19 across the state, with over 11,000 deaths. In Mobile County, we are at a cumulative number of COVID-19 diseases at 41 people with COVID-19 disease at 41,466. We're adding, in the double digits, in the low double digits every day. And last week, for example, for the entire week, just 152 cases were reported to us. About 96 of those were actually, infectious last week. So the number of COVID cases continues to stay low, which we are really, really happy about. So the number of people who have died with COVID, the cumulative number for that is 814. And if we look at our weekly expanded report to look at the number of people who had date of death last week, there were only 2 that have been reported to us so far. So that number is likely to increase because, again, there is a great delay in getting death certificate data or data on deaths transmitted to us, as those death certificates have to be certified before they are released to the public. As far as the number of people hospitalized with COVID-19 in a Mobile area or a Mobile County hospital, that number is almost at 5,000, 4,996. One additional person was hospitalized yesterday, and on any given day, we're seeing in the high 20s, low 30s of people hospitalized any day for COVID-19. So I would really feel a lot better if that number got much lower. But the good news is it's been decreasing. So, there were a lot of outdoor events that happened over the weekend. There was a pretty big celebration in Mobile on Friday night, and then on Saturday, celebrating the commissioning of the USS Mobile. Lots of people attended. I think I heard for Fat Friday or Tardy Gras for the parade that the estimate was around 64,000 people were in downtown Mobile. And then we also had a lot of high school graduations last week, and the ensuing celebrations and trips that follow high school graduation, lots to celebrate. So we will, again, if you were in a crowd for, in any type of crowd, particularly a large gathering that includes people coming in to the area from, different cities, counties, states, countries, maybe, those situations are high risk for COVID transmission. So if you were vaccinated and you were in those crowds without a mask, then you, at least 95% of you will be protected from getting COVID. If you were not vaccinated and you were mixing in large crowds, within close proximity of people who don't live with you or aren't in your household, then you still have you have a higher risk of exposure, right? The incidence of COVID in our community now is quite low. The percent positive is still down below 5%, so that is good news. There's less COVID around, but it doesn't mean there's no COVID around. And again, when you're in those situations, it increases your risk. We want to celebrate. We want to enjoy summer. Encourage you to get vaccinated so that you can do those things without, knowing that there's nothing more you can do to protect yourself. If you get fully vaccinated, you are doing the most that you can do to protect yourself. So we'll be watching for the next 14 days to see if we see a spike or an increase in the number of COVID cases transmitted over the last 3 or 4 days last week. So let me see if there was anything else I was going to say about the COVID numbers. Let's see. I think that's about it. Okay. Um, a couple of things I just want to remind people of. If you do get COVID, even if you're vaccinated, if you get COVID, if you test positive for COVID, you must stay at home for 10 days. That has not changed. That will continue to be in effect. Anyone who has COVID, whether they're symptomatic or not, whether they're vaccinated or not, anyone who tests positive for COVID will have to isolate for 10 days. Anyone who is exposed to someone with COVID, so if you've been around somebody with COVID, we prefer that you stay at home for 14 days, but you have the option to stay at home for 10 days as long as you're asymptomatic at day 10 and you continue to monitor your symptoms through the full 14 days. So isolation for people who have COVID and quarantine for people who are exposed to COVID are still in effect. This is a state law that you comply with these public health measures. And again, all in effort to try to reduce and maybe eventually get close to eliminating COVID transmission in Mobile County. So please get vaccinated. If you're vaccinated and you're exposed to someone with COVID, then you are exempt from quarantine, right? So only people who aren't vaccinated will have to quarantine after they're exposed. But if you're diagnosed with COVID, whether you're vaccinated or not, you still need to isolate. And also, just a reminder, I'm hearing some thoughts and opinions that people kind of are presenting themselves as being vaccinated because they had COVID. But again, the only kind of concession that a person who has COVID gets is that for 90 days you don't have to quarantine, or you should not get tested again. We just don't know enough about natural immunity, how long it lasts, how strong it can fight off COVID infection, and how much it could protect you from disease and hospitalizations and deaths. There's just not enough complete information on those. So previously having had COVID does not count as having full immunity. It doesn't replace vaccination. If you've had COVID, you should still get vaccinated, because a fully vaccinated person is someone who's had two shots of Moderna or 2 shots of Pfizer, and it's been at least 2 weeks since that last shot, or it's 14 days beyond your shot of Janssen or Johnson & Johnson vaccine. So that's the only thing that qualifies as a fully vaccinated person. Someone who's previously had COVID is not considered vaccinated. All right. I think there was a question I'm going to answer. Yeah, I'll answer that in a minute. All right. It's time to talk about some COVID vaccine events. So Mark, my screen's not on anymore. Sorry. We've got a really long list, and so I'm trying to figure out if it's better to read it off the paper or off the prompter. So I will start with the paper. Oh, here we go. Sorry. Thank you, Mark. So let me just remind you that, we're not taking appointments for COVID vaccination. It's just first come, first serve. We're getting people through really fast. So having a walk-in system is working really well for us. So I'm going to talk first about first dose events. Remember, these are first dose events, but if you are overdue for your second dose, come on and we'll give you your second dose, but just make sure that you go to a clinic that's providing the product that matches your first dose. So if you got Pfizer first, you need a Pfizer second. If you got Moderna first, you need a Moderna second. All right. First dose Pfizer at Occupational Health Center on 2050 Michigan Avenue. This is out at the Brooklyn compound. This is going to be a weekly clinic every Thursday from 8:30 to 4:30, right? Pfizer event, Occupational Health Center, every Thursday from 8:30 to 4:30. We also have this week a first dose Pfizer event. Let's see, this is, I believe, Friday the 28th. Can you check that's yes. Friday for me? Friday. Okay, Friday the 28th. And that is at Carbox. This is at 7220 Airport Boulevard. Again, Pfizer, 12 and over for these Pfizer events. We also have a first dose Pfizer event on June 1st and that is at the St. Paul African Methodist Episcopal Church. You can have a Methodist/Episcopal church. I'm learning something new every day. So that's on June 1st. Okay, hold it right there, Mark. Back up a little bit more, sorry. Yeah, that's good. Thursday, car box the 28th. Okay, we got it. Sorry, June 1st at St. Paul AME. I already mentioned that one, African Methodist Church. Okay, so then the next round of first dose Pfizer's June 2nd at Goodwill Church Ministries on Grant Avenue. Also a first dose Pfizer on Christ United Methodist Church on June 2nd. This will be from 9 to 12 in the morning. We have afternoon first dose event on High Power Church Ministries, June 3rd. And then the last one right now that is on our MCHD Cares website is the first dose at Mount Hebron Church Ministries on Brookley Avenue. This will be June 4th from 9 till 12. So a lot of events that first week of June. We have like 2 or 3 events every day. So go to mchdcares.com where you can find the information on the vaccine product that we're going to be using, the location, and the times. Remember, first dose Pfizer for 12 and over. Okay, second dose vaccines, remember, bring your card, bring your card, bring your card. All right, so on May 24th, second dose Moderna at Little Rock AME Zion. I'm sorry, is that today? Okay, yeah, today. Yeah, wow. Looks like that one probably has already ended. So second dose Pfizer at AIDT Eric Hine Learning Center. This is up in Calvert. So if you got vaccinated there on May 6th or 7th, come back to see us at the Eric Hine Learning Center. Again, bring your vaccination card. Pfizer booster dose on June 1st for everybody who received their first dose on May 11th at the Citronelle High School gym. Go back there. Then let's see, Pfizer booster June 4th for everybody who received their first dose at Art Walk. This again is at the Downtown Mobile Alliance. That'll be June 4th from 4 to 7. Then second dose event at the Nova Espresso coffee shop on Anthony Street, June 5th from 8 to 11. Second dose on June 22nd. And this is the follow-up for the one that we just announced at St. Paul African Methodist Episcopal Church. So let's see. I think all those second doses are further down in June, Mark, so we'll skip those. Something new that we want to highlight is check MCHD Cares again tomorrow because we're going to add a couple of more first dose clinics. It looks like at Viger High School, Just for Development Lab, and Fortis College. These will be in, I guess Viger is actually tomorrow, and then the Development Lab on June 2nd, and then Fortis College on June 3rd. So we'll get those added to our websites and our telephone number 410-MCHD later this afternoon. But we're really excited to announce a new project to vaccinate people who are homebound. This has been a very challenging time to try to get around to people to provide them vaccination in their home. Many of the home health agencies are not able to offer vaccination. The Mobile County Health Department has worked with the State Health Department and a few other partners to get our hands on some Johnson & Johnson vaccine. So this is one dose only. So this one dose completes the series. So we have started an initiative to provide J&J vaccine, the one dose full coverage vaccine, to anyone who cannot leave their home for whatever reason. So if you are homebound for health reasons, if you're homebound for transportation reasons, you can go to mchdcares.com and request in-home vaccination. So we'll just ask you a couple of questions: your name, your telephone number, your address, and how many people in your home want to get vaccinated. So we can vaccinate you, your family members, your caregivers, if there are any there. Again, remember, J&J is for 18 and older, so we can't vaccinate children with this one, but we are excited to try to work with our partners to provide in-home testing for people who are homebound. So go to our website, mchdcares.com, and click on the Request M-Home Vaccination. There's a tab at the top of the ribbon, or there's a big old section in the middle of our landing page that says, are you homebound? You can request our team to vaccinate you at your residence by filling out the in-home request form. So again, we'll just ask you for a little bit of information. It's Johnson & Johnson vaccine. Let us know how many people 18 and over. It'll take some coordination, right, to get this done, because remember, these vaccines are very fragile with regard to storage and once you puncture a vial. So the J&J vaccine only has 5 doses per vial, so that'll make it a little bit easier for us, we hope, in that we can, map our path and be able to provide vaccine to people who need it and reduce or eliminate any wastage of vaccine, because once we puncture the vial, we have just a very short time with which to use it. So I think that answers all the questions we had today. I just want to thank everyone again for what you've done in the past few weeks to keep the COVID numbers low. We want everyone to have a safe and healthy summer. Kickoff to summer is this weekend with Memorial Day. I won't see you again probably from 2 weeks from today, unless we decide to do a Facebook Live on Tuesday, Mark, after the holiday. So we'll have to talk about that. Mark's shaking his head that we probably will. So I do whatever Mark tells me to do. So have a great Memorial Day. Stay safe. Get vaccinated so that you can enjoy the summer with the confidence of being protected from COVID-19. All right. See you, everyone. Have a great week.